We will now present an interprofessional patient case.
The objectives of this presentation can be seen on the following slide.
The patient presented with the following chief complaint. This dry mouth is really frustrating. I've heard about Zofran now being used for IBS. Could I use that? The history of present illness. SG is a 62-year-old woman who presented to her PCP in September of 2012. She presented with moderate, frequent left lower quadrant abdominal pain, bloating, distension, and fatigue. She also described a rapid development of loose and watery stools that often occurred more than 5 times per day with significant urgency. She was diagnosed with IBS. SG was initiated on hyoscyamine ER 0.375 milligrams by mouth every 12 hours. In May of 2014, she complained of mild dry eye, blurred vision, and significant sudden onset dry mouth. Her GI IBS symptoms have been well controlled for the past year. Her episodes of abdominal pain, bloating, loose stools, and fecal urgency have decreased to only 1 to 3 times per month. Other important details from her HPI will be discussed throughout the presentation.
The patient's past medical history includes hypertension, presbyopia, cervical arthritis, chronic insomnia, and irritable bowel syndrome. The patient's past surgical history includes a gallbladder removal in May of 1986, an appendectomy in 1986, a left knee ACL and meniscus repair in May 2011. The patient's family history is non-contributory to her IBS but includes hypertension, stroke, hyperlipidemia, and myocardial infarction. Her mother is deceased at age 82, secondary to heart failure, and her father is deceased at age 83, secondary to heart failure and stroke complications. The patient's social history includes denying tobacco, alcohol, and illicit drug use. She's married with 3 children, and she is a registered nurse for 42 years.
We will now discuss the patient's allergies and medications. The patient reports no known drug allergies. For medications, she is taking amiloride hydrochlorothiazide and atenolol with the doses seen for the treatment of her hypertension. She is taking hyoscyamine for the treatment of her irritable bowel syndrome that is diarrhea predominant. She also takes ezopiclone for the treatment of her chronic insomnia, and she takes both meloxicam and acetaminophen for the treatment of her osteoarthritis and other pains. She uses Visine Tears Dry Eye Relief every morning for the treatment of her dry eye. The patient also is taking a multivitamin and vitamin B12 every morning. The following review of symptoms was obtained from a patient interview on May 27, 2014. It is important to note that the following symptoms were reported as current symptoms by the patient. The patient reports having significant dry mouth. At this time, she denied dry eye or blurred vision. The patient reports difficulty sleeping the night prior to the interview. The patient denies having palpitations. For gastrointestinal symptoms, the patient denies abdominal pain, bloating, diarrhea, and constipation at that time. The patient reports lower back pain, but denies pain at that point in time. The physical exam is provided as shown. Pertinent positive and negative information was not available. However, we would like to see further information for her head, eyes, ears, nose, and throat exam in addition to cardiac and abdominal exam findings.
The following laboratory data information was obtained by the patient via the patient portal from 11/12/2013. It will not be discussed in this presentation but can be found on the slide presented. Additional testing, including sigmoidoscopy or colonoscopy, are desired but not required for this patient due to her presenting IBS symptoms.
The following problem list encompasses problems from the patient's past medical history, in addition to medication-related problems that will be discussed by the pharmacy student, and optometry-related problems that will be discussed by the optometry student. Note that other problems were identified, but they will not be discussed at this time. The following problems are the medication-related problems. We will only be discussing 4 of the 7 identified problems. The first problem is the high priority problem of dry mouth caused by hyoscyamine. The patient complains of significant dry mouth with random and sudden onset due to the drug. Next is a medium priority problem that was identified. For the cervical arthritis experienced by the patient, she needs additional drug therapy. Despite meloxicam and acetaminophen use, the patient complains of persisting neck pain. For acetaminophen, the medication dosing regimen was not optimal. This was also identified as a medium priority risk. For the treatment of osteoarthritis, acetaminophen 1,300 milligrams by mouth every 8 hours is recommended on a scheduled basis until control is achieved. Patient began treatment with acetaminophen on an as-needed basis, not a scheduled basis. The last problem that will be discussed is the dry eye and blurred vision that was induced by hyoscyamine. This is a low priority problem and will be discussed further in the presentation.
This slides include the optometry focus problem list. The first is an adverse drug reaction with hyoscyamine-induced dry eye and blurred vision. This reaction will be discussed further in the presentation. The second is presbyopia. Presbyopia is an age-related visual impairment. It results from the gradual decrease in accommodation expected with age and can have multiple effects on quality of vision and quality of life. Presbyopia without optical correction results in an inability to perform near tasks at customary working distance without experiencing visual symptoms. Because the need to read and work at near and intermediate distances is important in all industrialized societies, presbyopia has both clinical and social significance and should be addressed by an eye care provider. For the patient's current near-work needs as a nurse, it is recommended that she wear her over-the-counter readers for all her near-work demands as needed to prevent symptoms. The third is hypertensive retinopathy risk assessment. Hypertension is one of the most prevalent diseases worldwide. It affects nearly 50 million Americans and 2/3 of the population above age 65. Hypertension isn't always obvious, and sometimes a change in ophthalmic vasculature may be the key sign in the diagnosis of hypertension retinopathy. Optometrists play a key role in co-managing hypertensive patients through posterior segment ocular cues such as flame-shaped hemes. As a patient's hypertension is well controlled with medication, the likelihood of developing hypertensive retinopathy is low, but a yearly dilated fundus exam is recommended.
We will now begin the SOAP assessment for the patient's irritable bowel syndrome. We will first begin with the subjective data. The first of this data was obtained from September 2012. The patient presented to her PCP with abdominal pain, bloating, and fatigue. She complained of the pain and bloating on and off for the past 2 years. She also complained of loose and watery stools, often more than 5 times per day with urgency. She said that she had changes in her eating routine, had increased stress, and increased work demands. The symptoms disrupted her daily activities both at home and at work. She completed a short-term self-treatment with Gas-X, charcoal caps, and Tylenol. The patient was initiated on hyoscyamine ER 0.375 milligrams by mouth every 12 hours. The data from May 2014 includes the past medical history of the diagnosed diarrhea predominant IBS. The patient complained of mild dry eye and blurred vision that self-treated with Visine. She also complained of significant sudden onset dry mouth 2 to 3 times per week that interfered with her speech. She stated that her abdominal pain, bloating, loose stools, and urgency had decreased to 1 to 3 times per month. She continues to take her hyoscyamine ER 0.375 milligrams by mouth every 12 hours. However, she only takes the PM dose if she experiences symptoms. The objective data for the patient was an abdominal exam that showed moderate tenderness in her left lower quadrant. We have made the assessment that SG is a 62-year-old woman diagnosed in September 2012 with diarrhea predominant IBS. Her symptomatic presentation of abdominal discomfort and associated with a change in frequency and form of stool for a time period greater than 12 weeks met the Rome-3 diagnostic criteria. Supportive symptoms including greater than 3 bowel movements per day, loose or watery stools, and urgency were also present and contributed to the diagnosis. Upon diagnosis, she was prescribed hyoscyamine ER 0.375 milligrams by mouth every 12 hours. At a later visit, she was instructed to only take the PM dose if she was experiencing symptoms. SG has noticed the development of mild dry eye and blurred vision and significant sudden onset dry mouth. She complains that when the dry mouth occurs, it interferes with her ability to speak. Due to the anticholinergic effect of hyoscyamine, dry mouth, dry eye, and blurred vision are common adverse effects associated with the drug. For the past year under treatment, Her episodes of abdominal pain and diarrhea have decreased to 1 to 3 times per month, showing effective treatment with hyoscyamine. Upon patient request, ondansetron efficacy was evaluated. Due to its lack of efficacy for the treatment of pain, ondansetron should not be used in this patient in place of hyoscyamine ER.
Additionally, it has been recommended that refreshed tear should be initiated in place of Visine tears due to the presence of BAK or benzalkonium chloride. This is due to the fact that BAK is toxic to the cornea and can cause tear film instability and results in epithelial damage over time.
For the patient, we have determined the following goals of therapy. We would hope that the patient would maintain successful management of her IBS. Also, we hope to minimize occurrence of dry mouth and its disruption of her daily activities. We would also like to prevent development of dental caries, periodontal disease, and oral candidiasis associated with long-term hyoscyamine use. Our final goal is to minimize her discomfort due to the dry eye and blurred vision.
Our pharmacological plan for this patient is to continue her hyoscyamine as directed, discontinue the use of Visine tears due to the BAK, and initiate use of refreshed tears lubricant eye drops, placing 1 to 2 drops in the infected eyes every morning as needed, which does not contain BAK.
The following is a non-pharmacological plan that we have developed for the patient. Since it is quite extensive, we will only mention a few of the plan items. First, we would like for her to maintain a symptom journal and food diary in order to identify possible triggers. She should also avoid any identified foods that may exacerbate symptoms. She should avoid caffeine, alcohol, and artificial sweeteners. For her dry mouth, she should increase water consumption with frequent sips, and she should also avoid dry, hard, sticky, and acidic foods. The following are monitoring parameters that we would like for the patient. For efficacy, we would like continued or sustained improvement in her IBS symptoms, and we would like to evaluate her dry mouth and dry eye in 4 weeks. For toxicity and adverse events, have the patient report any of the following if experienced: palpitations, flushing, or tachycardia, worsening or increasing frequency of her dry eye or dry mouth, urinary hesitation or retention, constipation, heartburn, nausea, or vomiting. Patient education. Take your hyoscyamine ER 30 to 60 minutes before meals. Do not crush or chew the hyoscyamine ER tablets. Contact your doctor if your IBS symptoms begin to worsen or if new symptoms occur. Report to your doctor if any of the following occur: palpitations, flushing or increased heart rate, urinary hesitancy or retention, constipation, heartburn, nausea, or vomiting. Also, follow the non-pharmacologic plan that we have previously discussed.
We also recommend stop using a Visine tears dry eye relief to treat your dry eye. Use refreshed tears as needed. Place 1 or 2 drops in affected eyes as needed each morning. Do not touch the tip of refreshed tears container to any surface. If the color of the solution changes or becomes cloudy, do not use. Throughout this project, the importance of interprofessional collaboration has become apparent for patient management and care. We especially want to highlight the importance of understanding and respect, defining the roles and responsibilities of the 2 healthcare providers, communication, accountability, unified expertise, and the importance of comprehensive healthcare for our patients.
As we worked through the patient case, it became evident that the common connection between pharmacy and optometry. Our identification of hyoscyamine-induced dry eye shows the importance of 2 disciplines working together to formulate a plan that can help manage patients' symptoms. In a pharmacy setting, when a patient presents complaining of eye symptoms and desires an artificial tear product, it is important for the pharmacist to consult with an optometrist to make the best decision possible. It is also important for an optometrist to consult with a pharmacist when specific drug-induced side effects occur.